Okay, let's dive into this. Every really good idea usually starts somewhere totally unglamorous, right? Well, this one starts with some simple arithmetic. Picture a completely theoretical decision tree. Let's give it, say, 10 levels, and at each of those levels you have exactly 6 possible choices. So how many total paths exist from the start to the finish line? If you multiply that whole thing out, you're looking at 60,466,176 unique trajectories. Over 60 million paths to navigate what is essentially a completely artificial toy problem. Now imagine replacing that little toy example with a real, breathing human being. A patient gets bitten by a venomous snake. They arrive at point A, and your one and only goal is to have them walk out of that hospital alive at point B. The combinatorial explosion there is, well, it's literally staggering.
Welcome to The Explainer. Today, we're unraveling a massive core medical mystery. How on earth do clinical experts actually save lives when the math is sitting right there telling us there are hundreds of millions of ways things could go wrong? Well, spoiler alert, they don't sit there calculating millions of paths. Instead, they use something known as the Avinash principle. It's basically a masterclass in finding the exact structural levers, the critical hub nodes, that totally control a complex system's entire trajectory. And today, we're going to explore how we can apply this genius pruning strategy to our own complex challenges. We've got a really highly structured journey ahead of us today. We're going to start with the 60 million path problem, move right into the pruning engine, identify our critical hub nodes, and then we'll explore attractor basins, push versus pull strategies, and finally, trajectory forecasting.
All right, Section 1, the 60 million path problem. Let's really look at the scale of what we're dealing with here. So let's set the stage with a totally unrestricted medical scenario. If you actually map out a real snakebite journey, pre-hospital response, transport, triage, diagnostics, ICU escalation, complications, the whole shebang, you get about 12 levels of decisions. And the math on that? It scales to a staggering 244 million possible paths. That's nearly 250 million ways a single patient's case could theoretically unfold. It's wild, right? This demonstrates exactly why trying to standardize medical care is just mathematically hostile. There are simply way too many variables. But if a standard hospital journey creates 244 million paths, how do we systematically shrink that monster? Well, we purposefully restrict our setting. Let's put one duty medical officer in a district hospital in India. We take away the ventilators. We remove all the complex labs. They literally only have a basic 20-minute whole blood clotting test and a limited stock of anti-snake venom. But here's the kicker. Even with these severe constraints, mapped across 7 clinical stages, the math still leaves us with 1,458 unique trajectories to a living discharge.
So how do we make that massive problem almost disappear? We introduce strict clinical guidelines, and this forces a fascinating phenomena called algorithmic collapse. It basically acts like a machine that just deletes unnecessary decision points entirely. Think about it. If that 20-minute clotting test is abnormal and the patient has symptoms, giving antivenom is no longer a choice. It's absolutely mandatory. By doing this, we strip away all the provider variance, squashing that complex matrix down to bare biological variance. Suddenly, that huge labyrinth of 1,458 paths shrinks down to just 54 realistic trajectories.
Moving on to Section 2, the pruning engine. This is where we need a major cognitive shift.
Because let's be honest, the truth is that no clinician is standing at the bedside calculating probabilities across 54 different branches in real time either. So the crucial point is captured perfectly right here. Human cognition isn't a pathfinding engine. It's a pruning engine. Novices, they try to calculate every single option step by step, kind of like a chess computer. But true experts, they discard 99% of the decision tree immediately. No hesitation. They spend absolutely all their cognitive energy focusing solely on the 1% of moments that actually determine the system's gravity. This actually draws heavily on complexity science, specifically power law dynamics in scale-free networks. In interconnected systems, most nodes, well, they have almost no influence at all, but a tiny, tiny fraction act as superconnected hubs. And controlling these hubs doesn't just, nudge the system, it literally determines its entire structural integrity. You're basically looking for the exact threshold, the phase transition boundary, where a system's behavior can flip from stable to completely unstable. It's like finding that one single grain of sand that triggers the entire avalanche.
Which brings us to Section 3, critical hub nodes. This is all about identifying leverage. When we start analyzing these hubs, the highest leverage node, the one that absolutely decides failure or success, isn't always biological. Actually, it's often deeply biographical.
And this brilliantly illustrates the two categories of nodes we're looking at. First, we have the explainable nodes. These are grounded in mechanism and biology. For example, that 20-minute clotting test we talked about dictating the antivenom protocol. But then, we have the experientiable nodes. These are narrative or behavioral patterns. Imagine our snakebite patient is a 34-year-old farmer who is just absolutely terrified of losing his daily wages, and maybe he has a history of leaving the hospital against medical advice. If he leaves before the neurotoxic window closes, well, your perfectly executed biological protocol completely fails. His anxiety is a critical hub node. But here's the catch. You absolutely must practice bifurcation awareness. You need to recognize the dark side of every lever you pull. High leverage nodes, they are double-edged swords for sure. The exact same antivenom that neutralizes the snake venom and saves the patient's life can also trigger a catastrophic lethal anaphylactic shock. Every intervention needs a built-in circuit breaker, like having adrenaline drawn up and ready at the bedside before the infusion even starts. You aren't just acting, you're acting with deliberate intent and structural resilience.
All right, Section 4, Attractor Basins. Let's look at real-time dynamics.
We're going to shift gears now from analyzing static paths to watching real-time dynamical systems control. We're going to treat the patient as a state vector moving across a curved phase-space landscape, kind of like a physical landscape with three main basins. On one side, you have collapse. That's the critical, highly unstable crash zone. In the middle is the Goldilocks zone, which is this nice, homeostatic, safe corridor where the body's natural systems take over. And on the far side is overtreatment, where you get instability caused by just way too much medical intervention. By tracking the micro-fluctuations of our hub nodes, we can spot what's called critical slowing down. This acts like a really crucial early warning system, showing us that the system is becoming unstable well before the patient actually physically tips over into the collapse zone.
Section 5. Push versus pull. Let's talk tactical control.
So when a patient does start drifting out of that safe Goldilocks zone, how do you intervene? It fundamentally comes down to a choice between brute force and structural elegance. Our default instinct is almost always the push strategy. This is continuous high-energy brute force against systemic resistance, like constantly titrating pressor medications to fight a patient's collapsing blood pressure. Now, it works, but it's exhausting and carries a super high risk of overshooting the target or causing a rebound. In contrast, the pull strategy is a single, low-energy, structural shift applied directly to a critical hub node. Instead of shoving the patient back to the middle, you change the shape of the basin itself, so the system just settles naturally.
Let's move to this next concept and see how this builds perfectly on the contractile law of least resistance flow. You literally reshape the energy landscape itself. If the patient is a ball rolling toward the collapse basin, you don't push the ball, you flatten the wall to the Goldilocks zone and deepen the well in the center. You just let the body's own natural feedback loops and gravity do all the heavy lifting to glide the patient right back into safety.
Finally, Section 6, Trajectory Forecasting, taking a longitudinal view.
Now, let's zoom out from that immediate phase space snapshot to longitudinal forecasting, because we really need to answer the ultimate question. Where is this patient actually ending up in 6 hours or even 6 weeks? A longitudinal forecast plots the patient's state over time. You mark time 0, that's their current state. Then, assuming your current treatment plan holds steady, you draw a single predicted trajectory line forward. But around this line, you plot a best case and a worst case envelope. At 6 hours, that envelope is tight. You can be highly confident in where they'll be. But project that out to 6 weeks, that best case/worst case envelope widens drastically.
And that widening envelope, that visually represents compounding uncertainty. It separates two questions that we honestly confuse all the time. Is the patient okay right now versus is the trajectory actually heading somewhere good? Having this visual keeps us incredibly honest. It forces us to verify if the entirety of that envelope is converging into the safe Goldilocks corridor over time, or if they're quietly, secretly drifting toward the collapse boundary despite looking perfectly stable today.
So here is the challenge I want to leave you with today. Stop trying to calculate every single path in your professional mazes. How can you apply the Avinash principle to identify the 1% critical hub nodes in your own complex systems? Stop managing the noise, practice the grandmaster level skill of skill-free pruning, find the exact levers that change your system's gravity, and just let the natural dynamics do the rest. Thank you so much for joining me on this explainer. Keep learning, and I'll catch you on the next one.